Hello, I'm Leslie Podesta from the Fred Hollows Foundation.
And I'm Paul Courtright from the Kilimanjaro Center for Community Ophthalmology.
Many people don't realize that there is a gender basis around vision loss and blindness, and today we're going to talk about some of those things. So Paul, nearly 2/3 of the 45 million people who are blind are female. Most people don't know that. Has that changed over the last 10 years?
Actually, it has changed. We have to remember that it was only 10 years ago that we even discovered that there was this huge gap. And since discovering it, many groups have then said, why do we have this? And it became very clear that it was because women don't have the same level of access to eye care services as men do. So the change really has been programs and organizations and countries saying, what are we going to do about it and how are we going to address it?
Is it just because women have less access to health services? Are there any other reasons why there's such a significant number of women?
Fair question. Actually, women do have a slightly increased risk of cataract compared to men. But the fact is, we all know that cataract is operable. So why should a woman go blind from it? Trichiasis. Yes, women have an excess risk of trichiasis compared to men. But why should a woman go blind from it? So women do have an excess risk of eye diseases. Women do live longer than men. But there's no reason why a woman should go blind just because she's older or just because she has these diseases.
So what is the impact? I know it's often been said that for the Fred Hollows Foundation, our most common client is a poor woman in a rural area. So what are some of the impacts for families and communities to have such a high number of women without vision?
I think most people recognize that the woman, the mother, is the center of the household. And it is really the woman who makes sure that the kids get off to school, that the food is on the table, that keeps the glue, and I use that term freely, keeps the glue of the family together. The other thing that we have found is that if a woman has education, is literate, that woman is more likely not just to receive eye care herself, but also to make sure her children get that necessary eye care.
One of the other issues that we've noticed is that if people are blind, that it's girls who tend to be their carers. So I guess it has that other significant impact for young women missing school, missing employment.
Yeah, that's very true.
Hope, what are the things that we can do to improve this? What are the things that we've done that make it different?
I think what's happened has been on the ground. There's been in a number of countries, in Tanzania, Egypt, Nepal, a number of countries, people have made concerted efforts, and the gap is closing. But those are only in some areas. And we need to really work at making it much more broad-based. And we need to engage with the other non-eye care providers. Because addressing women and their eye care needs is really one of the areas of poverty reduction. Because that is how we reach the people at the farthest end of the road.
I might just share with you, obviously this is a big issue, and I think it's really critical that we keep talking about it. I was surprised last night to talk to a really senior person who said, there's no gender basis to blindness. People still don't believe it. So it's important that we keep talking about the issue, but also share the successes. We've seen some really positive things. We're about to start a terrific initiative in Sri Lanka in association with the Elder Citizens Clubs, and a very interesting approach looking at healthy, active aging. Mostly it's women, and we've recognised that not just looking at musculoskeletal and social isolation and nutrition, which is all big issues for women in the poorest parts of Sri Lanka, but many of them have significant vision issues. And surprisingly, if they can't see, then their opportunity to participate in all of the other issues. So we've seen the opportunity to increase women's access through other things, not just eye care, but including eye care into those things that will support women, particularly older women.
What we have found in work in Tanzania is that by engaging with the microfinance programs, which are really addressed at poverty alleviation, those microfinance programs can be our promoters.
Yeah.
They can be the ones who take that message forward. And it's made a huge impact on increasing utilization in those areas.
And let's just finish up with workforce, because it's the big issue for all of us. So I guess one of the issues is making sure that we have culturally appropriate ways of doing this. We recognise that men and women in different communities, in different settings, it's not the same. So what are some of the innovative workforce approaches that you've seen at work?
In different cultures, you have to address it differently. And what I have seen that I think has been very, very interesting is working with teams. So that, for example, when doing mass drug administration for trachoma, making sure there's a woman who is part of that team to ensure that women in the community have a sense of comfort, have a sense of security when they're involved in receiving drugs. So making sure there's a balance, because that balance is important for service delivery in the field.
Absolutely. And of course, a very simple one, recognizing that for women who are largely confined to home, training a female workforce who are able to appropriately visit at home and provide services and education, absolutely critical. That's good. So we've got some hope. You
have some hope. I think there's a lot of challenges ahead, but the success of the past can be built on, and yes, we have great hope for the future.
And we need to make sure that everyone understands that there really is a gender basis to vision loss.
Definitely. Thank you, Leslie.
Thank you, Paul.